Good morning, everyone. I went through some of your questions from your note cards last night, and I have some answers for you that I wanted to post on Canvas so that you have access to that going forward. To start off, I'm going to address a question that was asked in class about the development of play and the ages that you should expect certain um, play skills to develop at. If you check your OT for Children book, pages 79 to 81, in box 31 to 34, you'll find the ranges of play skills along with other skills. Um, and then the ages at the top of the box. So you'll see the ages at the top of the box, and then the first skill that they talk about is in regards to play. So you can kind of see the transition from there. So now I'm going to start some of the questions on your note cards. So the first one I have is, how do you know when to administer tests like the Bailey? Does every child get at least one assessment? This is really up to your clinical judgment, but you'll notice that certain settings have preferences for which assessments they use. And this actually kind of touches on another question about the settings. So you'll see a lot of the Bailey and the Peabody in outpatient settings, and you'll see a lot of the M-Fun and the BOT in school settings. So it really depends where you're at, and it depends on the preference of that specific setting. And oftentimes you'll see if your setting gets um, it has a large population of one disability or another, you may find a different assessment is beneficial. For example, when I was in the CP clinic, we used the Quest a lot, and then we would use the Peabody and try to adapt it in the best way possible for some of our kiddos with hemiparetic cerebral palsy. And when you have to adapt an assessment like that, there's chances that you may not be able to do it standardized, and you just need to document that. But it'll help you kind of see some of those skills. What are the most types of populations of children that you do assessments for? I think that also varies on settings, but you will see a lot of kiddos with developmental delays, with fine motor delays, with handwriting difficulties, with autism spectrum disorders, sensory processing differences, Down syndrome, cerebral palsy, really that whole gamut. And oftentimes that's what you'll see in outpatient and school settings. When you get to the inpatient setting, you might see kids with cancer or traumatic brain injuries or stroke. And then acute, you can really see anything. You may have kids that are there for other medical reasons, but also have developmental delays or disabilities. So you'll really have a unique experience when you get into the acute settings. A few of you asked how long it takes to get comfortable doing the Bailey. I think that really depends how often you're using it. If you if that tends to be the gold standard at your setting, that's the preferred assessment to use, then you're probably going to learn it a lot quicker than someone who's only using it every month, once a month. I was fortunate enough to be able to practice with it every week during field work in the neonatal follow-up clinic a few times a day, that once per week. And my CI had been practicing for 25 years, and there were still items at the end of my 12-week experience that we would go back and look up because maybe it was a more complex skill that we didn't have a lot of kids that got to, so we just didn't know it as well. So that's perfectly fine. What I did was I made myself a binder, and inside it I had the test booklets of the assessments that I commonly used in clinics. And I would add, let's see if I can find an example. I would add little notes here next to the item regarding the score guidelines or how to administer it. And then I would bring this with me to every assessment so that if I needed to, I could refer to it. And then I would be scoring on a different paper or test booklet. Our setting had laminated test booklets so that you can use them to score and then just erase it and reuse that in the future, since everything was computerized anyway. But that really helped me. And then also in my in that same binder, I had broken it down by subtest, but I have all of the scoring guidelines so that I can refer to that in a quick and easy way if I needed to. I don't think you need to do that for every assessment. I think if you're interested in doing something like this, this detailed, you can wait until you start fieldwork. Ask your clinical leads before you get started, what assessments will I be doing? And then you can put together a book like that. I had a binder for inpatient rehab as well. The next question is asking about prompting for items on the Bailey and whether that's appropriate or not. You can prompt for items to an extent. So you'll often see that Dr. Tanner was prompting by saying, keep going, or you're doing a great job, or tapping on it, but she may not say, put the peg in the board specifically. So you can definitely prompt them and try to motivate them, but you don't want to be too specific. And if you're ever unsure if you said something that shouldn't have counted, just double check the scoring guidelines or the administration guidelines afterwards, and then you can document on that. So this question is about play. Someone asked the difference between symbolic or pretend play versus imaginary play, and that's actually in that, you'll be able to find that in that chart as well on pages 79 to 81. But to give you a little kind of an example, symbolic or pretend play is where you're using objects and pretending there's something else and you're playing with them in a setting. So that's kind of the example where you're using a ball and pretending it's an apple and you're feeding it to your bear. So it kind of sounds like imaginary because it's not a true apple that you're feeding to the bear, but it's not. It's just pretend at that point. When you get to imaginary play, that's when you don't have anything at all in your hand and you're feeding the bear the apple. So that's when you're actually not using objects for that. You're just imagining that it's there. Are you allowed to use standardized sizes of objects for the Bailey? Example, using a bigger mug for the item 54 with the 9 blocks. A few of you asked that question. I realize in the video it looks like they're not going to fit, but I promise they do. I've seen it done, and we can play with that a little bit on Tuesday. But those are standardized items that have the equipment that comes with it. So make sure that you're using the equipment that the Bailey sends with those items. There's a reason that we're using that mug. It's to try to see if they can problem solve to get them to all fit into the mug. A few of you asked about parents. So does having the parents close by while doing the assessment skew the results? People noticed that the mom stayed after the kiddo had his little meltdown. Was that okay? And I'm just going to reiterate that it's totally up to your clinical judgment. If you find that the mom is distracting the child or something like that, you can ask them if they don't mind stepping out so that you guys can really focus and see how well he can do. If you find you have a parent who's trying to help them a lot, where they're giving them a lot of cues or telling them, putting their hands on them and trying to show them how to do it or demonstrating it, just explain to the parent, oh, we're trying to see what they do. It's not a big deal if they don't get it right or wrong. We just want to see what he can do without the help. Sometimes parents feel pressured in those situations, so that's why it's nice to just reiterate that. But in the case of the video, I didn't think the mom was distracting him any more than he was. So I would have been fine with her being there, but that's up to you. If you feel that he was being more distracted because she was there, you could definitely ask her to step out for a little bit and see how he does. What would be your course of action if the therapist made a mistake while administering a standardized assessment? That's a great question because it's going to happen. And you could go back into the room if the family's still there and ask if you can redo an item. We just want to double check something. And then you can do that item correctly. Or if they have already left, just make sure you document in your notes that I didn't do this item standardized. And that's it. What do you do if a child does not show resilience during an assessment and you cannot finish it? That's a good question. Usually you'll find a way to get back to it. You can take breaks, you can play games, get out their favorite toy, ask their parent or guardian what is it that they like to play with and bring that out so that you have something fun for a little bit. You can call mom and dad to help calm them down. Some kids really benefit from some motivation by Cheerios or suckers or stickers or whatever your setting has. I always had extra stickers on me because I found for whatever reason kids really like them. So that is kind of an easy one that usually parents aren't going to say no to, that you can use to try to get them through it. For example, there was one assessment where I was doing the Bailey with a kiddo, and for just a section of the assessment, he really was starting to lose it, and I had to give him stickers after every item. But we got through that, and then once we got to the gross motor section, he was totally fine. On the Bailey, if there are multiple grasps within the item that you test the child on, and the child performs the more advanced grasp, do you score the earlier grasp as 0, even though the child may have just been past those grasps in development? So no, if you look in the scoring guideline, similar to the play skill, um, if they're demonstrating a skill that is of a higher level, of a more complex level, you can still give them that. So the pencil grasp ones are kind of spread out, so you might not run into that problem as much as some of the other ones. But as a general rule of thumb, you can think if it's more complex, it probably counts, and then just double check your scoring in the guidelines if you're not sure. If it's not timed, how long do you give them before saying they can't do the item on the Bailey? That's a great question, and it's totally based on your clinical judgment. A good rule of thumb that I like to go off of is if they're interested and they're still working on it, keep going. Encourage it as much as they're working on it. You'll see the kids, once they can't get it, they get frustrated, they'll push it, they'll throw something, they'll be playing with something else or tapping it on instead of putting pieces in the puzzle. And at that point you can stop it because they're not trying anymore. They've lost their interest on it. A few of you asked questions on the basal and ceiling, so I'm going to post a video with more in-depth description about those later on today. But I want to also clarify the sequenced items because I wasn't 100% sure which you were referring to in some of these questions. So this one says, how do you know when to skip on to another item or to another section on the Bailey? So in reference to the sequenced items, you will just use the booklet, and you'll see, let's see if I can find one. You'll see this one right here. There's numbers on the side of the item that tell you which number you can move ahead to that uses the same materials, so that way it'll save you a little bit of time. And then as for knowing when to skip back to things on the basal and ceiling, we'll talk about that in that other video. How often are the assessments like the Bailey administered, mainly as an evaluation? Yes, the Bailey is mostly used for evaluation. Criterion referenced assessments are typically the ones that we would use to help with treatment planning or goal writing. So those might be used a little more in contexts other than evaluations. But a good rule of thumb as far as what evaluations to use is to try to use a standardized assessment and then do either a criterion referenced assessment for your treatment planning or just observations. I kind of created a list of things I wanted to see from kiddos in my observations afterwards, and that helps me a lot. A lot of you asked about the time frame for how long the Bailey and the Peabody and other assessments like that would take. Please review the charts on pages 165 to 166 because that has a section about the duration of the time for all of those assessments. I can't stress enough the importance of those charts going forward. It really helps to have an estimate about what kind of components are on each assessment, how long they take, what ages you can do it for, because that's what's going to help you choose whether the assessment is appropriate or not for a child. For what is provided by a setting for testing kits? What if they don't have something integral for the test that they should provide? Where does the treatment session go from there? The items that aren't provided in the Bailey are pretty easy to obtain. They're like note cards or Cheerios, which most settings have something of that nature or something that you could replace for that. So I would just, if the parent's around, I would just say, do you mind hanging out for a second? I just have to go grab some materials and I'll be right back. And then I would just go get something as close as possible if you don't have note cards or Cheerios. When we first start practicing, will assessments take up most of our time within therapy sessions? So just to clarify, most of these assessments won't be used in therapy sessions. They'll be used during an evaluation. And yes, it probably will take up the majority of your evaluation time. Hopefully you'll have a little bit of time at the beginning to do some parent interview and a little bit of time at the end to just watch the child play and make note of some observations. Um, as for therapy sessions, if you are doing an evaluation to kind of just assess where he's at for your own knowledge and for your own treatment planning, I would maybe even just do sections of it, because you want to make sure that you're also doing some kind of treatment during that session, because it's not, an evaluation isn't really going to help. It'll help you with the treatment planning to know where to go, but it doesn't really, it's not an intervention. So it's not really, if you're going to be billing for treatment, you need to do some kind of intervention in that time. Somebody asked about the differences between criterion referenced and norm referenced assessments. There's a great chart on page 173 that you guys can reference for that. The basic differences are that norm referenced assessments use statistics to quantify a child's progress, and you can use those to determine if they're eligible for therapy or not. Criterion referenced assessments use functional skills, so it's really great for treatment planning and writing goals. However, you cannot quantify their scores in the same way, in the same statistical method, so you cannot use it to qualify a child for services. If an OT has to do extra prompts or demonstrations in order for the child to accurately complete the task, do you count it as a 1? It depends on the scoring guidelines, so you can double check. But like I discussed earlier, you can use certain prompts to an extent. Just be careful about the wording. You don't want to be too specific about what you want them to do in the task. You can just be more motivating and inspirational. Would you combine types of evaluation, norm and criterion referenced in one evaluation, or typically stick to one? I like to try to do some kind of norm reference test at the beginning. There's times where a child is just not going to be appropriate for a standardized test, and that's okay. But that's usually my goal, to do a norm reference test and then observations afterwards. You could do a criterion referenced assessment as well, because that'll kind of help you get your observations and get that functional skill information. Someone asked with the PE body, if a kid is 5 years and 6 months, can we still use it since it goes to 84 months? And yes, you can, because 84 months is 7 years of age, so you've got a little while still. How involved can the parent be with helping get the child's attention? They can be as involved as you need to, as long as it's not giving away information about the items that they're doing. Just getting their attention back. Have them help you as much as you can. If it makes your life easier, that's great. What are some concrete examples between norm referenced and criterion referenced assessments? The Bailey and the Peabody are norm referenced. The HELP is a criterion referenced, and the PDCAT is actually both, which we'll be talking about next week. And I think the HELP is one of the last ones we'll talk about. How do you go about choosing the correct assessments? This is a great question, and it takes some clinical judgment. But your fieldwork, your clinical instructors will help you with that a lot. And eventually people get preferences, so you may be picking based on something you're more comfortable with, as long as it's still appropriate. But I like to start with the age and then look at the concerns noted in the referral to find which assessment matches best with those. And if you're in between something, you can do it dependent on time. If you want to see other observations, you may want to try the shorter one. If you're really comfortable with one and it's going to be a difficult kiddo, do that one. So they both have good inter and intra-rater reliability and validity as far as the Bailey and the Peabody. So you can use that clinical judgment and try to figure out what's going to be the best for that kiddo and for your relationship with that kiddo. Kind of answered some of these. When needing to document notes on testing, such as parent reports but not displayed, is that documented on the test itself or in the treatment note? You would document that in the treatment note, and you would have to double check the scoring guidelines as far as whether you can count that towards their score or not. So if you counted it, if it said it was okay, then you probably don't even need to document it. But you could, just to be safe. And then if you weren't able to score it, you can say, their score may be impacted because I didn't see this today, but parent reports that they do this all the time at home. Okay, and then our last question is, if a child is older than the ages on the assessment, but is cognitively younger and can't get any points on an assessment for their chronological age, can you use a younger assessment with them? I love that question because that will happen. You're going to have kids that aren't a good fit for certain assessments, and you can choose to try a younger assessment just to see some of those skills, but you cannot score that as a standardized assessment. For example, if you're using it to qualify them for services, you're going to have to use an age appropriate standardized assessment that they just won't do well on. But if you're doing it to get your own information, you can use parts of an assessment. You can do observations. You can use a younger assessment, and you just can't score it and say it's a standardized assessment. It would just be for your own information and for your own treatment planning. So I hope that helps. It was a great week with all of you, and I'm looking forward to next week. Be on the lookout for the basal and ceiling video coming later today.